Hello, I'm Chris Wood. I'm Director of Dental Implant Solutions. Today we'll be showcasing a brand new exciting dental implant treatment called Same Day Weld 1 Teeth. We're going to be replacing a lady's failing bridge with a brand new dental implant supported bridge in the space of 1 day. So let's get started. The first thing we'll do is meet the patient, make her feel relaxed and explain what's going to happen next. So now we're going to start by explaining to the patient exactly what she can expect from today's procedure. We're going to provide her with an antibiotic to reduce the risk of infection, and some pain control, and then the local anaesthetic to numb the area we're going to be working on. Next stage is ensuring the patient is comfortable, that the area is properly anaesthetised and numb, and then we're going to remove the bridge, the failing bridge. We're going to remove the failing support teeth very carefully, preserving the tissues carefully around the area, and once we're happy that everything is looking clean and healthy, we then proceed to prepare the sites for the implants. A pre-prepared surgical template, together with preoperative cone beam CT assessment, is used to position the implants accurately. Once good implant stability is confirmed, smart fix abutments are attached to correct the natural implant angulation so that a screw-retained restoration can be made. Next step is attaching the welding sleeves onto the implant connectors. We then form a titanium wire, and we have to check that it's actually contacting the welding sleeves adequately. We then use the Weld 1 intraoral welding system to weld the wire onto the welding sleeves, and that forms the strength and the framework for the replacement teeth. The next step involves a technician, so we hand the framework to the technician. He will then modify and trim and check that that framework fits within what we call the Pro Shell, which is the outline of the replacement teeth. Once we've trimmed the framework and made sure it's fitting snugly onto the implants, it's checked in the mouth. We then try the prosthetic shell over the top of that, and then with the composite material, that Pro Shell is bonded onto the framework. The final stage is trying the finished bridge work into the mouth. We fit it snugly onto the implants, check the fit at the gum level, check the fit on the neighbouring teeth, check the patient's happy with the appearance of it, and we'll also check that functionally it's going to work with the patient's bite. And there it is, the finished bridge. We've gone from taking a failing bridge out, placing implants, making a framework and fitting the finished teeth in 1 day.